I'm very excited to have this opportunity to present our upcoming publication, Letter to the Editor on Asia-Pacific Perspectives on the COVID-19 Pandemic. And I thank Professor Chesmi Actis, the Editor-in-Chief of Allergy, for giving us this opportunity. COVID-19 caused by the SARS-CoV-2 virus was declared a pandemic by the World Health Organization on March 11, 2020. Since then, we have over 162 million cases world over. The Asia-Pacific region is a geographically diverse region with diversity in the cultures, in the diet, in the ethnicity, the healthcare systems, and different levels of access to specialized services. The COVID-19 Task Force of Apache commissioned a survey to understand the epidemiology, the clinical phenotypes, the comorbidities, the characteristics and management of patients with allergic and clinical immunological diseases, the therapies of COVID-19, and the allergic conditions that were manifested in the healthcare workers. A questionnaire comprising of 44 questions was sent to 15 countries, and consolidated responses were received from 14 out of the 15 countries. As you can see here, the clinical phenotypes were mainly acute respiratory infections, asymptomatic individuals, and pneumonia. ARDS and multisystem inflammatory disease was rather uncommon. The common comorbidities were hypertension, diabetes, cardiac disease, COPD, and malignancy, whereas asthma and obesity were low. Pediatric cases were less in number and were milder, and multi-inflammatory systemic disease was not seen in these, was rather rare. The common atopic conditions among the healthcare workers were allergic rhinitis, asthma, chronic rhinosinusitis, and ocular allergy, and the skin manifestations were mainly atopic dermatitis and contact dermatitis, mainly attributable due to the gloves, the N95 masks, the PPE, and the goggles, and the repeated hand washing. Many of these patients were on different types of therapies, and clinical trials on therapies ranging from antivirals to immunomodulators, anti-cytokines were being carried out, and over 80% of the countries had national guidelines on COVID-19. The patients with allergic and clinical immunologic diseases did not go so often to the hospitals, so telehealth and teleconsult became more common in many of the countries. Biologics, immunomodulators, and immunotherapy were continued during the period of the pandemic for the patients with allergic conditions like asthma, allergic rhinitis, chronic urticaria, and atopic dermatitis. In conclusion, I'd like to say that this survey done in the first year of the pandemic provides crucial information on the clinical phenotypes and comorbidities of COVID-19 in the Asia-Pacific region, the allergic conditions in the healthcare workers, the management of patients with allergies during the pandemic, and the therapies for COVID-19. These findings provide crucial information that can guide future public health measures, infection prevention and control, and vaccination policies comprising risk stratification and safe implementation of vaccines. The relatively low numbers of COVID-19 in Asia-Pacific were attributed to the strict public health measures, contact tracing, testing, isolation, quarantine, and border controls as compared to US, UK, and Europe. In fact, certain countries like Australia, New Zealand, Taiwan, and Thailand did the very best as compared to other countries like Indonesia, India, Philippines, and Malaysia. New testing and therapeutic modalities continue to evolve, especially with SARS-CoV-2 mutations and variants that are developing over time. We look forward to having a further survey that would update us on the current status of COVID-19 in our region. Thank you very much.